Hi, I'm Dr. Roadhouse, and we have Erin with us, and she just turned 16. And Erin, why don't you tell why you came in to see us?
Well, I basically just kind of started off at some point in time many years ago. I don't remember exactly when. I just kept having headaches, and they slowly increased in duration and frequency until it was basically about a year ago became one continuous headache, which is quite literally a pain. So we went to various doctors. We just kind of, I think that we actually started off with just my general doctor. And people kept telling me, oh, well, it's probably just migraines. So they kept giving me various types of migraine pills. And they didn't work because they weren't migraines. And we ended up going to a neurologist who ordered several tests. I did wow, I just forgot the name of it. It starts with an E, the electro.
Well, you did the EEG.
EEG, that's
right.
what it was. And then I also had an MRI and an MRA, and I spent my 15th birthday getting an IV for a CAT scan. So that was nice and fun. And through all those things, they were like, well, gosh, golly darn, there is nothing turning up from this. So finally my neurologist referred me here, and then we went through this whole deal with my dad being like, chiropractors don't do anything. And then
We showed him.
yeah. Hey, I don't have symptoms now.
Yeah. Well, so when you went to the doctor, the neurologist did the EEG, which is the brain pattern, electrical conductivity of the brain. That was negative. You did an MRA of the brain, right?
Yes.
That was negative. Did a CT on your 15th birthday
Yes.
with IV, and that was negative. And then pretty soon, you know, they just were out of options with you, and that's when your neurologist sent you here, right?
Yeah.
Okay, so talk a little bit about the dizziness too. I mean, you know, when did that crop up, and what did it make you feel like when you had it?
Dizziness didn't really start until the headache was about to like half a day long or so, and then it would just be like randomly, oh hey, the room looks like it's spinning around, and so that really wasn't cool.
Okay. And when you said that you had headaches, and they kept getting worse and worse, and then they became one constant solid headache. I mean, how was that, like over a year where you had a headache straight for 1 year?
For several months or so,
Okay.
and then it was about half a year, I think,
Okay.
before I came here.
All right. So it's just one constant headache that just stayed there and you never got any relief. How did that affect your sleep? I mean, were you able to sleep when you had that
I
thing?
didn't sleep, which isn't that good if you want to get nice grades in school.
Yeah.
You know, they tell you, hey, have a nice long sleep before this test. That's true.
Mm-hmm. Okay, so she tried, quite a bit of different testing, several different. How many medications do you think you tried?
Well, I was on Elavil for a while. I remember that one. I had valproic acid. I don't even know what that is, but it didn't do anything. I was on something else, and then they put me on this really strong pain med for a while. And that was nice for the 2 hours that it lasted, and then it went away. And then it's like, you probably shouldn't be on really strong pain meds. So picked me off that. And then, I was actually addicted to Advil for a while, which is possible, but that's not good. So.
Yeah. And what about, you were talking about the migraine medicines. I mean, how many of those did you try?
2 or 3 of them, I think.
Did you have to do any of the ones where you injected, or were they just pill form?
No, they were only pills. If they had been injectable things, I would have gone to a different doctor.
Yeah. Well, you just never know. I mean, when they're trying to anything they can, they'll try, especially someone your age, having you know, constant headaches like that, you know, and headaches that stayed around for 5, 6 years, you know, at your age. And they did everything right by ruling out tumor, you know, anything organic or, you know, but they just didn't really know what to do with you. And so that's why they tried those different medicines. Okay, so what's it like now, you know, waking up, no headache, going through your day? How are your grades?
Which class?
Yeah.
Mostly they're good.
You don't have to talk about that, I'm just messing with you. But just, you know, kind of talk about, you know, what it's like now, you know.
I can sleep occasionally, which is pretty nice, and I don't have dizziness, which is also very nice because, you know, it's pretty cool not to be standing there and suddenly,
And the room was spinning. And
Yeah.
Okay. And then the headaches, obviously, you're doing great
Yeah,
that
they're
way
gone,
too. Okay, so makes it easier to go to school, makes it easier to study and get your homework done, right?
I don't study.
Because she gets good grades. All right. Okay. Well, what I'm going to do is I want to switch and bring your mom in. Okay. And I want
Probably
to get
has
her.
more information.
Yeah, I want to get her perspective. You can go out there and, you know, have a seat out there. We'll be right with.